Good morning, everyone.
Good morning.
Welcome to a beautiful day in downtown Flushing, in front of the world's best and most famous public library, the Queensboro Public Library here in Flushing.
Yeah.
And this is also the place where we make our most important announcements and gatherings. And in the AAPI community, we have seen a significant increase in diabetes. Earlier this year, Assemblymember Ron Kim and we passed legislation in the New York State Assembly and the New York State Senate, respectively, that would require insurance companies to screen for diabetes at a lower BMI threshold. What does that mean? The body mass index is an indicator of possible diabetes. And currently the national standard is a BMI of 25 before the diabetes screening is required. The problem is that there are many Asian Americans who may not have the definitions of obesity, but are still prone to diabetes. And in fact, there's a nationwide move to drop that threshold from BMI of 25 down to 23, so we can better capture, in particular, Asian Americans, as well as other at-risk populations. So we passed the legislation this year, and we are now standing here together to ask Governor Kathy Hochul to sign the bill.
That's right.
As far as we can tell, most insurance companies are doing the right thing in New York because they're following certain federal guidelines. Unfortunately, though, we have seen in the last year or so federal guidelines being changed, being lessened, being rejected, that puts communities like ours in harm's way. And so we can no longer simply rely on federal guidelines. We need to have our own requirements legislated into law here in the state of New York.
As a physician, I want to make one thing very clear. BMI is not a one-size-fits-all when it comes to diabetes risk. For Asian American Pacific Islander patients, the medical evidence tells us that diabetes can develop at lower BMI levels. If our screening and insurance policies don't recognize that, we can miss the disease until patients are already suffering from preventable complications. I was proud to work with Senator Lieu and Assemblymember Kim on behalf of the Medical Society of the County of Queens and the Medical Society of the State of New York to help bring clinical evidence behind this legislation forward. The legislature has now passed the bill. The next step is simple. We need Governor Hochul to sign it into law. Screening for diabetes at BMI of 23 isn't about labeling people. It's about finding diabetes earlier, treating it earlier, and preventing complications. That's good medicine, and it's good public policy. Thank you.
I think we're all here because we all have personal connections to the scourge of diabetes. We all know a loved one who has this disease, and if you're Asian American, they may be very skinny, right? I mean, we all have relatives who are quote-unquote skinny fat and still suffer the consequences of diabetes. So this is really important. These personal stories, they add up, okay? So at Charles B. Wong Community Health Center, we see more than 5,000 patients a year in trying to control their diabetes. And we're able to do so in most of these cases, in more than 80% of cases. But it starts with going to the doctor every year and having a comprehensive screening. So this is really important. It also just makes sense, right? I mean, it makes sense from a system perspective. It costs 10 times more to treat diabetes than to screen for it. It costs 10 times more than that if you actually have untreated diabetes. And it costs 10 times more than that if you have something severe like kidney failure. So it just makes sense for all of us to catch this very early. I know all of us have personal stories, and I look forward to hearing them all.
Many people may ask, why on earth we care about this diabetes? Why don't we talk about many other things here? As a physician, of course, I'm very sensitive and compassionate about it. But the fact is, it's a very serious public health crisis. In America, there's 37 million individuals suffer from this disease. In New York State alone, is 1.8. The average populations in New York City is 7% of population suffer from diabetes. But guess what? In Queens, we have 13% of patient population suffer from diabetes. So this is not a little thing that we can just walk by. And why screen, right? Why bother doing it if there's nothing can be done? Because there's so much can be done. First of all, having a disease doesn't mean you're sick, but yet over time, one can develop problem. Picking up early, meaning by screening, can definitely make a difference. Studies published by NIH and many others have shown early intervention can help to prevent development of those kidney and eye problems, which we know commonly associated with diabetes. It can make an impact. However, we know our Asian American populations is very different. BMI of 25 is not enough. Again, it's not like a secret. Many times they've been shown BMI of 23 is the most optimal for our population, for everyone around us, for our sister, our brothers, our parents, our children even, right? By doing it, we can actually lowering the BMI to 23. We can uncover over 200,000 individuals each year who are diabetic. Not to count the ones who are pre-diabetic, who can benefit even more. Otherwise, in 10 years, they will develop the side effects. So this is, again, a long journey. Actually started off about more than a decade ago in San Francisco. The initiative already started. Since then, 6 states, including Hawaii, California, Illinois, Washington, Virginia, they have all joined the effort to pass it as resolution. But our senator, assemblyman, they have something different. They want to make it as a bill, to be a law, to really hold our insurance company accountable for this important issues. Make a difference. Now they're already at the table. We have to make sure our governor also understand and see us. Thank you.
Thank you.
In my own practice, I see firsthand why this legislation matters. Research have shown that by lowering down the BMI from 25 to 23, it sounds like not a big change, but the significant impact can be big. And it shows already low down the it increased the sensitivity of diabetes and prediabetes by 24%. Earlier screening means earlier intervention and a better chance to prevent higher healthcare costs. We hope this bill to be signed and more New York Asian American can get the benefit of early screening and better health conditions. Thank you.
So I'd like to echo what the previous speakers have said about the health consequences of diabetes. And in practice, we see not just primary care, but all the complications that these patients and the families have to endure. So our Chinese American Medical Society has been supporting this initiative for many years. In 2022, we held webinar and publicized along with other groups the importance of screen at 23. So I'd like to join everyone in urging that Governor Hochul to sign the bill and provide better care for everyone. Thank you.
As a physician, so we practice evidence-based medicine, which means so our clinical decision should be guided by clear evidence, which says clear evidence from the USPSTF recommend screening for diabetes for Asian Americans should be lower the BMI to the threshold of 23 instead of 25. We urge Governor Hochul to sign the legislation into the bill, and this law will make all the New Yorkers, including Asian Americans with a BMI more than 23, to have the equal opportunity for screening for diabetes without worry about the financial barriers. That is a good medicine we should practice. Thank you, the leadership. Thank you.
I see a large aging American populations. As a provider, I see how prevalent diabetes is in our community. In Asians, I see them at a younger age and at a lower body weight. Not only am I a provider for diabetes, I am also a patient with diabetes. 10 years ago, more than 10 years ago, coincidentally, I was diagnosed when I was trying to teach one of my patients how to use her glucometer. And with this early diagnosis, I was able to change my lifestyle and hopefully slow down the progression of this disease. And that is what I want for all of my patients. And with this lower BMI screening, we can build a healthier community for our future. Thank you.
I was diagnosed with diabetes about 30 years ago. At that time, I did not know much about diabetes. I did not know about prediabetes. I did not know about BMI. And I did not know that a simple blood test could show that I was risk. My doctor did not tell me that I had prediabetes. I did not know that I was getting close to diabetes. Then, one day I was told that I had diabetes. I was very frustrated. I asked myself, why didn't I know earlier? Why wasn't I warned earlier? If I had known, maybe I have taken action earlier. About 10 years ago, I found the KCS Diabetes Self-Management Program. That program was offered in my own language. So I signed up right away. For 6 weeks, I learned how to manage my diabetes. I learned about healthy eating. I learned about exercise. And I learned how important it is to understand my blood sugar. After the program, I made a commitment. I wanted to help my family, my friends, my community. I wanted to tell them, know your risk. Get tested earlier. Don't wait until you have a diabetes. Today, I'm sharing my story because I don't want other people to have the same experience I had. Early testing gives us chance to know. It gives us chance to learn, and it gives us chance to act. I hope Governor Hochul will sign this bill. I hope more people can get tested early and protection their health. Thank you.
I think a lot of people already mentioned how Asian Americans are impacted by this the BMI level. And at KFSC, we serve many Asian American families, and oftentimes we hear them saying, oh, I'm not overweight, so why would I have diabetes? So that is the misconception that this bill addresses. This bill is really about our moms, our dads, our aunties, and our grandparents who feel fine, who look fine, but may have diabetes or pre-diabetes for a long time. So I want to thank Senator John Liu and also Assemblymember Ron Kim, and we urge the governor to sign this bill into law. Thank you.
Director of our Queens Community Service for Chinese American Planning Council, CPC. We are the nation's largest social service Asian serving nonprofit in New York City. And so in addition to providing multi-social services, we also provide health education and services as well for everything from assisting people with HIV/AIDS to people with intellectual developmental disabilities to our home health aid attendant program. And when we do these services, we provide everything not just in language, but culturally competent services. A lot of times people ask us, what is culturally competent services? So if you allow me to tell a quick story, in our diabetes education workshops, not only do we discuss this BMI issue, we also tell many times for pregnant women, you've probably heard this, so many aunties say, oh, you're eating for two, you should eat more, right? And the dangers with that. So cultural competence services is really meeting the community where they're at, understanding their background and cultural context. So this bill, thank you so much, Senator, and also for Assembly Member Kim, for championing this bill that is very not just inclusive, but also culturally competent. And we're gonna hear on behalf of the community to really implore the governor to sign this bill to provide the additional safety nets for the fastest growing group here in New York. Thank you.
I am here because this issue is important to me because I am diabetic. And in fact, diabetes runs in my family. And I was lucky that my health care covered early screening. And so I know what I have to do every day. Handful of pills, that's my meal some days. And I know how important getting diagnosed and getting that intervention early on. So good public policy. Keeping New Yorkers healthy is good public policy. So I want to thank Senator Liu, I want to thank Assembly Member Kim, and we urge the governor to please sign this bill to keep New Yorkers healthy. Thank you.
I'm here today on behalf of our members, our grandparents, parents, small business owners, young families all across Queens, to say clearly, our community needs this bill signed into law. My mom is pre-diabetic. I have 4 uncles who have diabetes. It runs in my family as well. It's very personal to me. For too long, the standard BMI threshold of 25 has failed Asian Americans. It was built on data that did not reflect our bodies or our risk. We have all heard of somebody, maybe a parent, a family member, friend at church, who looked healthy, who wasn't overweight by the old standard, but they were still blindsided by a diabetes diagnosis. That's not bad luck. That's just a broken screening system. The science has now caught up. The CDC and the American Diabetes Association already recommend screening Asian Americans at a BMI of 23. This is nothing new. What we need now is for our insurance system and our state to catch up as well. This bill does 2 things our community has been asking for. It lowers the threshold to reflect real risk, and it removes the co-pays and deductibles that keep so many of our elders and working families from getting screened in the first place. Early detection saves lives. It also saves money for patients and for our whole healthcare system. On behalf of the Korean American Association of Queens, I want to thank Senator Liu and Assemblyman Ron Kim and every legislator who fought to pass this bill through both chambers. Now we are asking Governor Hochul to finish the job. Governor Hochul, sign this bill. Our community is watching and we are grateful. Thank you. Once again, I want to thank this incredible community for coming out. You know, look, I mean, we're Asian Americans. We're still trying to fight for our fair share. And this is definitely one of our fair share. We need public policy and state law to help protect people in our community against the scourge that has been increasing in more recent years. And we need the standards to safeguard us and our family members as well. And that's why we signed this legislation with many of these organizations and advocate support. You were in Albany. You were talking to our fellow legislators to get them to pass this bill. We passed the bill, and now, Governor Hochul, we need you to sign the bill. Governor Hochul, please. Sign the bill. Sign the bill. Thank you so much, everyone. Sign the bill. Sign the bill. Sign the bill.
For our Asian American Pacific Islander population, pre-diabetic occurs earlier than the standard BMI of 25. Studies have supported it and shown for this population, for our population, when we start at BMI of 23, we can uncover more patients who are on the trail of becoming diabetes and then be able to identify them. The main reason is because we have effective programs, medications that we can implement to educate the patients what to eat, what to do, exercise or medication. On the other hand, also help to standardize medical care to our providers. So as a providers, we know the proper way to screen our AAPI population. One reason is because the BMI 23 is not here to redefine what overweight or obesity is. It's to set the new standard for all of us to recognize the need to start looking and start implementing effective methods to cure the disease.
I know Governor Hochul cares deeply about the Asian American community. This is an issue that perhaps not everybody's aware of, which is why there's been a nationwide movement to lower the BMI threshold to 23 from the current 25. And we passed legislation that would require insurance companies to cover this kind of screening. So we're here in large numbers. The entire community is out here to tell Governor Hochul this is a bill that's very important to us, and we ask her to sign it and to sign it as soon as possible. The community came to me with the bill to better protect them and their families, and that's what we're trying to do. Protect people against diabetes, lower that screening threshold so that more people can be screened and possible diabetes and pre-diabetes be screened and found early on.